Hello, everyone. My name is Chris Fogarty, independent Medicare broker with Fogarty Insurance Advisors. I'm going to take a few minutes with you today to instruct you on how to use Medicare.gov's Medication Finder to estimate your drug costs going into 2025. This is a pretty simple process. Don't want you to get overwhelmed with it, so I'll walk you step by step how to enter your medications and then what those medications really mean when you look at them as far as the drug costs go for your plan. So the first thing we're going to do is we're going to go over to Medicare.gov and we're going to start the process from there. When you land at Medicare.gov, you're going to see a number of options. If you've created an account previously, you'll choose to log in and you'll enter your unique username and password. It's okay if you've forgotten it or if possibly we helped you set that password up in the past. Go ahead and use your forgot username and password link. They'll ask you to verify your Medicare number and a couple other pieces of personal information, and that should help you to get right into your own account. We do recommend that all of our beneficiaries set up a Medicare.gov account. It helps you to very quickly look at your coverage, the plans which you're enrolled in, as well as any costs that you might get with your Medicare plans. If you have yet to set up your own account, you can also create an account here. Again, by using that Medicare number, setting up a unique username and password, and then going forward, you'll always be able to log in to your Medicare.gov account. And I'll tell you, the important reason to do this is as you fill prescriptions or as there are claims against your original Medicare benefits, everything is uploaded and updated in your portal. So if you ever want to go in and just verify that your medications are covered by your plan or that they have an updated list, you can always go to Medicare.gov and log in. So let's talk about today, if you don't have an account or you don't want to set one up, how can you find the cost of your drugs and review different plans, whether it be a Medicare Advantage plan with prescription drug coverage or just a standalone prescription drug plan? To do this, when you get to Medicare.gov, you're going to come down here to the Find Health and Drug Plans section, and you're going to click on Find Plans Now. Now, every time you do this without an account, you will have to enter your zip code. What this does is it ensures that we're pulling plans that you are eligible for within your county. Once you enter your zip code, you'll be able to choose between a Medicare Advantage plan, Medicare Part C, or Medicare Drug Plans, Medicare Part D. Medicare.gov also lets you quote the costs of Medigap policies if that's something that you wanted to do as well. But for today, we're going to focus on looking at prescription drugs and their costs. So we'll choose Medicare Part D plan, Medicare Drug Plans to start with. And if at any point after you enter your medications you wanted to look at Medicare Advantage, there's an easy toggle, which I will show you how to switch between the two. The next screen is going to ask you if you receive any help with your Medicare drug plans. These could be things like Medicaid, low-income subsidy, PACE or PACENet, supplemental security income. If you know you have some of those, click the appropriate button. If you're not sure if you qualify, choose that you do not get any help for these programs, and that will show you the standard cost for all drugs and all premiums. An added benefit to creating your own account on Medicare.gov is this will automatically be populated for you. If you qualify or have lost qualification for programs, it will be updated within this system. Once you choose the right option, go ahead and hit Continue. And here's the important part. We want to look at the cost of your prescription drugs so we can compare plans accurately. So you'll choose Yes, and click the Next button. From there, this brings you to your prescription drug list where you're going to add any of the prescription drugs you take. Now remember, these are only prescriptions that are given to you by your doctor and that you fill at the pharmacy. This does not include over-the-counter medications like Tylenol or most multivitamins. So if you do type something in like that, it's unlikely that it will be found. So I'm just going to put a few different medications in here so you can see the different options, so we can look at a couple of plans. As you start typing, the fields will auto-populate. So I'm looking for atorvastatin, which is your generic cholesterol medication. You're going to add the drug, and you're going to pick your dosage. All of the available dosages, standard dosages, will be shown here. And then you also pick the quantity. So this is the number of pills you take over the course of a month. If you prefer to use mail order, or if it's a medication you only get filled once a year, you can make that appropriate adjustment. So a mail order prescription would be a 90-day supply every 3 months. But we'll just choose a 30-day supply for a couple of these drugs. If, for instance, you take 1.5 pills a day, or you take 1 in the morning and 1 at night, you can adjust that. If it would be something where you would take 60 milligrams of a medication, and you have currently been taking a 40 milligram and another half, you can adjust the numbers to that. Or if you take a 40 and a 20 of the same prescription, you would just enter that in as a separate prescription drug. If you take a brand name drug, make sure you type that in correctly and put in that brand name of the medication. If there is a generic available, it will ask you if you want to take that generic. If there's not a generic available, it will not allow that to be an option, and it'll automatically put in the brand name drug. Here's an example of a medication that has a generic. And for most of you, you probably will be taking the generic medications. So you would want to add that in there, choose your dosage, and put that on your plan. So I have an example of 4 medications on here. That's all I take. So I'm going to say that I'm done adding drugs. The next important thing to do is to look up your pharmacy. You can choose more than one pharmacy if you'd like to. If you have some that you get through mail order, and you also like to go to your local supermarket or drugstore, you can choose multiple pharmacies and add those to your list. Once you've done that, click Done. Something that is handy to know. If, for instance, you utilize a CVS pharmacy, but the address that's showing is not the accurate one, every CVS is going to have the same costs as another one. So if you see the nearest CVS, you can go ahead and choose that one, and it will not affect the cost of your medication. Once you hit Done, this is where it's going to now show you all of the available plan options in your zip code. And if you remember, we are looking at prescription drug plans. So these are going to be 2025 plans. The default view is going to be over here in the Sort Plans By. It's going to default by lowest drug plus premium cost. So that means that these numbers over here on the left-hand side, those are the cost of the combination of your plan premium on a monthly basis, plus what it will cost as an estimate to fill your prescriptions over the course of, in this case, a 12-month period, January through December of 2025. As you scroll down, you're going to be able to look at all of the available plans in your market. Right now, There are 14 prescription drug plans in York County that you can look at. As you scroll down, you'll see that the costs might be different between retail pharmacy and mail order pharmacy. So if you prefer to do all of your work through mail order and get all your medications through mail order, look at those numbers to ensure that you are going to get the plan that's going to cover you at the best rate. Things to look at here, you'll see you have your monthly premium of, in this case, is a $12.60 plan. The estimated total cost of your drugs and your premium over the course of the year will be at a retail pharmacy would be $1,948.06. Again, this is an estimate, so things could change slightly. If you use mail order, looks like there's some substantial savings with this plan of nearly over $200. So that is definitely something that you want to think about. The last thing that it will show here is your deductible. So the deductible is the amount that you are responsible to pay before the plan begins to pay for your medication. For many plans, the deductible is waived for your generic drugs, but that's not true with all of them. So this is where it becomes important to take into consideration the full cost estimate for the year. From our opinions, it's not as important what a singular drug will cost, rather looking at the totality of the costs that you're going to have for the year. So in this case, even with a $590 deductible, the total cost if you use mail order would be $1,721. If that's the lowest cost plan over the course of the year, that is a good option for you. If you prefer to use retail pharmacies and pick your drugs up in person, I would recommend looking at the cost for the retail pharmacy. Once you are interested in the plan, you can dive a little deeper into the plan details by clicking on the Plan Detail button. You can also compare plans. On the Plan Detail button, it will take you into the overview of the plan that you choose. In this case, it's the WellCare Value Script Prescription Drug Plan. It's going to outline your monthly premium. This plan has a $0 monthly premium. Your drug deductible, which again is $590 on this plan. And then it will outline the drug coverage. So this is another place where you can make sure that you that you've captured all your medications. And if you did realize you forgot one, you can simply click on the Change Drug button, which will take you back to your list, where we could choose to add another one, or if we realize we're correct, hit Done Adding Drugs, and it will take you right back to the plan. If you do change your medications or dosages, it will update on all of the plan options. At this point, it's going to show you your dosages, and then it's going to list your pharmacies. When you're looking at pharmacies, you may see a couple of different things. You'll see the word preferred with the check and in-network. Sometimes you'll see standard, or it might just say in-network without the word preferred. A preferred pharmacy is going to give you your best cost on the medications that you're taking. They have the best negotiated rates with each of the carriers. Not every pharmacy is preferred with every insurance company, so it is important to look at that. Again, if your current pharmacy that you did choose is not preferred, you can simply click on that Change Pharmacy button on the right-hand side, add a new pharmacy, and then come back to your plan. If you do that, since you're in a plan, it's going to give you the option to show preferred in-network pharmacies only. That way, it will weed out all of those that are no longer preferred for you. And if you uncheck that, there will be some other pharmacies that come up that may be in-network, but not showing as preferred. Again, every plan or every carrier may have a different list of preferred carriers. Once you look at your carriers and your pharmacies, you can look at the cost of the medications over the course of the year. So you'll see that we have most of your medications here are covered at a low copay, $0 for this medication, $0 for your Memprazole, but your Eliquis is a brand name drug. That's an expensive medication, so it has a higher cost, and on this plan, you're going to be paying a percentage. And then your venlafaxine is also a higher cost prescription. Those are the annual costs. If you wanted to see it broken down by month, you can look at it in that manner. So in this case, you're going to see that you're going to pay more money in the first month if you do it by a 1-month prescription because of the $590 deductible. And then your cost will go down from there. If you use mail order, it's going to default to a 90-day prescription, so you're seeing your prescriptions every 3 months rather than on a monthly basis. You will notice that in 2025, as you've heard, there is a cap on out-of-pocket drug costs of $2,000. So no senior will pay more than $2,000 for their covered prescription drugs over the course of 2025. You can see then a breakdown of the medications by retail cost, cost before the deductible, cost after the deductible, and out-of-pocket max cost, which will always be 0. And those costs that we see are generated based upon the tier or the level of those medications. For this specific plan, and I will note that every plan can have slightly different tiers, tier costs, and drugs within those tiers, you'll see that a preferred generic is $0 copay. A tier 2 generic, non-preferred generic, will be $5. Brand name drug, like Eliquis, will be a tier 3. You'll pay a 25% coinsurance. Tier 4 drugs, which are your non-preferred drugs, will be 42%. And then specialty tier or tier 5 medications are a 25% coinsurance. This could be a change for some of you for next year. So we want you to be aware of it. Again, here are your listings of tiers for each of those medications. After we've reviewed this plan, if you have any further insights that you wanted to look at, or if you wanted to compare plans, you can always do that. If you go back to the listing of the available plans in your area, you can choose the Add to Compare. Then we'll just do the first 2 plans. You can do up to 3. This is going to give you a high-level overview of the plan. All this is going to really show you on this level is your plan name and monthly premium, the deductibles for the plans, as well as the overall cost for your retail pharmacy and your mail order pharmacy. This can be helpful because, again, one of the most important pieces of this is what your out-of-pocket cost is going to be over the course of the year. And you don't want to pay more than you need to. At that point, if you have more questions about the plans or you wanted one of our team members to validate what you have found, we're happy to do that. We just ask that if you're able to go in and utilize Medicare.gov, it will help us be efficient and provide you with the best advice possible, because this is the same information that we're working with. We don't have a secret program that'll help us provide any more insight than what the government and what Medicare is showing us for these plans. But again, we're happy to review that and help you to get the right plan for 2025. If you have additional questions, please call our office, send us an email, and we'll get back to you with that information. Thanks very much. Have a great day.